When you get a health diagnosis, especially for something complex, like with your legs or feet, it's totally normal to feel a bit lost, maybe anxious. You can kind of find yourself wading through all this medical information, just wondering, what does it all actually mean for me?
Oh, absolutely. It can be completely overwhelming. Trying to make sense of it all feels like another burden right when you're probably already feeling vulnerable.
Exactly. And that's really why we're doing this depth dive today. This one is for you, the listener. We want to help clear up a specific tool your healthcare team uses for these kinds of complex limb conditions. Our mission really is to unpack something called the WIF system. And no, it's not your internet. We'll get to what WIFI stands for. It's a newer and, frankly, much clearer way doctors look at the health of a leg or foot that might be at risk. The hope is, by the end of this, understanding this system will help you feel more empowered, have better conversations with your doctors, and maybe feel a bit more in control.
That sense of empowerment is so important. It really is. When you understand the terms, the language the doctors are using, it helps build a real partnership. Clear understanding, it's fundamental to good care, especially when things are serious. It just leads to better results all around.
Okay, so to really get why this WIFI system is such a big deal now, maybe we should look back a bit. What was the challenge before? For a long time, doctors used this term critical limb ischemia, right? Or CLI.
That's right, CLI. It was first defined way back in 1982. And the idea then was to pinpoint a very specific group patients whose leg was in serious danger, mainly because of a chronic severe lack of blood flow. That lack of blood flow is what ischemia means. You pronounce it as ischemia.
1982. Wow. Medicine and, well, who gets sick has changed so much since then. What's like a really striking difference between that original idea and what doctors are seeing today?
Well, here's something that's actually pretty fascinating and maybe a bit surprising. The original definition, back in '82, it actually intended to exclude patients who had diabetes, or at the very least, study them separately.
Really? Exclude them. So the main tool they were using wasn't even designed for what seems like a huge group of people facing these problems now. That feels like a major gap.
It became one, definitely. And that original intention really highlights a huge challenge that grew over the decades. I mean, we've seen this massive global surge in diabetes over the last 40 years. And patients with diabetes, they often have really unique issues with their limbs. Blood flow is often just one part of a much bigger, more complicated picture. Just to give you an idea, in a lot of clinics today, somewhere between, say, 50 and 80% of the patients who need procedures to save a limb also have diabetes.
50 to 80%, that's a huge shift. So if the old system wasn't built for that reality, what other problems did it have?
Well, the other classifications used back then, things like the Fontaine and Rutherford systems, they were just too narrow. They really only focused on two main things, either severe pain when you're resting because of the poor blood flow, or visible tissue loss like an ulcer. They just didn't have a good way to factor in how bad a wound actually was, beyond just seeing it was there, or how serious an infection might be.
So if those older systems were kind of incomplete, what did that mean in the real world? Like, for doctors trying to figure out if one treatment worked better than another must cause some confusion.
Oh, absolutely. Huge confusion. Because the category CLI became so broad and sometimes used, frankly, incorrectly, it got incredibly hard to compare treatments effectively. It's like trying to compare apples and oranges, but you just call them all fruit. You lose the specifics. And for you, the listener, what this meant was your specific situation might have been lumped in with others that weren't quite the same. That makes it hard to know the real sort of natural course of the disease or compare different treatment strategies reliably. What's interesting, too, is that even in cases labeled critical ischemia, some studies show that, with really good wound care, some limbs didn't automatically need amputation, which just highlighted, again, that we needed a much better way to assess the whole picture.
Okay, so putting it all together for our listeners, it sounds like the medical world realized they needed a much better map, a more detailed guide to navigate these really complex limb problems more accurately.
That's a perfect analogy. The old maps just weren't cutting it anymore, especially with diabetes changing the landscape so much.
And that brings us to the WIFI system. The Society for Vascular Surgery developed this newer, more comprehensive approach. It's WIFI, standing for wound, ischemia, that's the blood flow we talked about, and foot infection.
Exactly. And the whole point of WIFI is to give doctors an objective way to classify the level of threat to your specific limb. You can think of it almost like a disease burden report. It's a bit like how cancer is staged. It tells you how serious things are. But, and this is important, it doesn't automatically tell you the treatment because treatments change, they evolve. Your doctor uses the WIFI score as a key piece of information, but tailors the treatment to you.
And I think what's really helpful is the grading scale they use. It seems pretty straightforward. Each part, wound, ischemia, foot infection, gets a grade, 0 to 3.
That's right. 0 basically means none. No real issue in that category. 1 is mild, 2 is moderate, and 3 is severe.
0, 1, 2, 3. Simple enough.
Yeah, that simple scale makes it much easier to talk about how severe things are.
Mm.
Not just doctor to doctor, but with patients and families too.
Okay, so WI and FI graded 0 to 3. Let's dig into the W first, wound. What are doctors actually looking at when they grade a wound? Is it just size?
That's a really good question.
Yeah.
Because it's definitely not just about how big it looks. Let's stick with that analogy we used earlier. If your limb is like a house, the wound is like damage to the house. And the wound grade isn't just about size, it's about depth, how complex it is, maybe what kind of repair job or procedure might be needed. Depth is actually more important than just how wide it is. So grade 0, W0, easy one. No wound, maybe you just have pain because of poor circulation. So in the house analogy, no damage yet, just maybe some stress on the foundation.
Okay, makes sense. No damage yet. What about a grade 1 W1 wound then? What level of house damage is that?
Grade 1 would be like a small, shallow ulcer, minor tissue loss. Think of it like a surface scratch on the paint or maybe a tiny crack in the drywall. It might be something fixable with a relatively simple procedure like maybe removing just one toe or putting a small skin graft on. Minor repairs.
Okay, and then it gets more serious. Grade 2.
Yes. A grade 2 W2 wound is deeper. It might go down enough to expose bone or a joint or maybe a tendon. So more significant damage. Think of it like a broken window that lets you see inside the house structure a bit. You might see some gangrene, that's tissue death, but maybe it's limited to just a couple of toes. Fixing this might involve removing a few toes or maybe what's called a standard 4-foot amputation.
Right. And the most severe, grade 3, what does that look like?
That's grade 3. W3. Now we're talking about an extensive deep wound. It might involve a large part of the front or middle of the foot, or maybe a really bad ulcer on the heel that goes right down to the heel bone. This is like, a whole section of the house has collapsed. Major structural damage, gangrene could be widespread. Healing this often requires really complex reconstructive surgery, or maybe removing larger parts of the foot. It really captures the full extent of the damage.
Wow, okay. Thinking about it as levels of house damage really does help visualize it. Thanks. All right, let's move on to the eye ischemia grades. Checking the plumbing. So ischemia, as you said, is about blood flow to the limb. Let's use the analogy. Blood vessels are like the plumbing in the house. How do doctors actually check that plumbing?
Well, poor blood flow is a huge risk factor for amputations, so checking it is critical. Doctors have a few key ways to measure it. You might hear them talk about your ABI, that's the ankle brachial index. It's a simple test comparing blood pressure in your ankle to your arm. They also measure pressure directly in the ankle or, really importantly, the toe pressure. That one's especially useful if you have diabetes or are older, because sometimes other arteries can get stiff and make the ABI less accurate. They might also measure oxygen levels right on the skin. That's called TCPO2. It all helps build a picture of the flow.
And how do those measurements get turned into the WIFI grades for ischemia? 0 to 3 again.
Yep, 0 to 3. So grade 0, I0 means great blood flow. Your house has fantastic water pressure everywhere, no problems. Grade 1, I1 is mildly reduced flow, maybe slightly low water pressure, but it's generally manageable.
Like maybe the shower isn't super powerful, but it gets the job done?
Exactly like that. Then grade 2, I2, is moderately reduced blood flow. Now you're noticing lower water pressure in some parts of the house. It's more obvious. And finally, grade 3, I3, is severely reduced blood flow. This is like a major blockage in the main pipe coming into the house. The pressure is dangerously low, maybe almost nothing. Patients with grade 3 ischemia are very, very likely to need some kind of procedure, we call it revascularization, to fix the plumbing and restore that blood flow. And here's a really key point. Sometimes, even if the ischemia is only moderate, say grade 2, you might still need that plumbing fix if the house damage, the wound, is really bad. Because a bad wound needs good blood flow to heal. It's not always a strict cutoff. It depends on the whole picture.
That makes total sense. A moderate plumbing issue becomes much more serious if the house itself is badly damaged. They interact. Okay, last one. Foot infection, FI, grades. Controlling the fire. So, if the limb is the house, infection is like a fire. Why is infection such a critical piece, especially with diabetes?
Infection is just a huge driver of problems,
Hmm.
particularly when you have diabetes and maybe poor circulation already. It's often the thing that lands someone in the hospital, and sadly, it's a major reason for amputation. So, grade 0, FI0, no signs of infection, no fire in the house.
Okay, straightforward. What about a mild infection, grade 1?
Grade 1, FI1 infection is mild, and it's localized. It's just affecting the skin and the tissue right underneath. You might see some redness, usually pretty contained, maybe half a centimeter to 2 centimeters around the wound, plus maybe some swelling, tenderness, warmth, or perhaps some pus-like discharge. Think of it like a small spark or a tiny fire in a wastebasket that's easily contained.
Got it. And then it escalates.
It can. Grade 2, FI2, is a moderate infection. Now, the redness is spread further, more than 2 centimeters, or the infection has gone deeper. It might involve things like an abscess that's a pocket of pus, or it might have reached the bone, which we call osteomyelitis, or maybe infected a joint. So the fire is growing, it's spread beyond that initial spot, and it needs a more serious response to put it out.
And grade 3, that sounds like the really dangerous one, limb or even life-threatening.
It absolutely is. Grade 3, FI3 is severe. This is a limb or potentially life-threatening infection. Now you're seeing what we call systemic signs, and the infection isn't just local, it's affecting your whole body. That could mean a fever maybe over 100.4 Fahrenheit, or sometimes actually a low temperature below 96.8, or a really fast heart rate, over 90 beats a minute, fast breathing, over 20 breaths a minute. Or your white blood cell counts might be way off. This is like a raging fire threatening the whole house and everyone inside. This grade, FI3, carries a very, very high risk of needing an amputation quickly. And it's really striking when you look at the data, how infection, especially when it's combined with poor blood flow, can basically triple the chances that a wound won't heal. It's often the tipping point.
Okay, so the doctors figure out the grade for wound, the grade for ischemia, and the grade for foot infection. Let's say someone gets a score like, I don't know, W1, I2, FI1. How do they put those three numbers together? What does that combination actually tell them?
Yeah, that's where the power of the system really comes in. You get that specific WI-FI combination, like your example, W1, I2, FI1. And while there are technically, I think, 64 possible combinations you could get.
Wow, 64.
Yeah, but they generally group patients into 4 overall clinical stages. These stages give a sense of the overall threat to the limb. So stage 1 means a very low risk of amputation within a year. Stage 2 is low risk, stage 3 is moderate risk, and stage 4 means a high risk of amputation. Obviously, someone with WA3, I3, FI3, severe everything is going to be stage 4, high risk. But even someone with, say, a W1, I3, FI, a small wound, but really bad blood flow and no infection, they might still land in stage 3 or 4 because that severe lack of blood flow makes healing extremely difficult. It's how the WI and FI factors interact.
And how does that WIFI score, or maybe the overall stage, connect to what kind of treatment someone might need, especially things like fixing the blood flow, that revascularization you mentioned?
Well, generally speaking, the higher your individual grades for WI and FI, the higher your risk of amputation is. The WI-FI system is also really helpful for estimating how much benefit you might get from restoring blood flow. For instance, if your ischemia score is 0I0, great blood flow, you're probably not going to need a revascularization procedure. But if you have severe ischemia, that I3 score, especially if you also have a bad wound or infection, then getting that blood flow restored is very likely going to be essential to give the limb a fighting chance to heal.
And you mentioned something really important earlier, that the score isn't set in stone, right? It can change.
Exactly. That's such a critical point. And it's part of why this system is so useful and, frankly, empowering for patients. Your WI-FI score isn't like a final verdict. Think of it more like a status report that can be updated. It's kind of similar to how cancer might be restaged after treatment. For example, if you come in with a really severe infection, maybe an FI3, the first step for your team might be to deal with that infection, maybe drain an abscess, or do what's called debridement, which is cleaning away unhealthy tissue. After they do that, they might reevaluate your WI-FI grades. Maybe the infection grade improves significantly. That new, hopefully improved classification then helps guide the next steps. Like, okay, now that the infection is better controlled, do we need to focus on improving blood flow? It allows treatment to adapt as the situation changes. It gives you and your team a concrete way to see progress, like hitting milestones in your recovery.
So let's bring it all back. Why does understanding all this WIFI stuff matter for you, the person listening, maybe a patient or a caregiver?
Well, this system, it isn't just medical jargon for doctors to use amongst themselves. It really is a powerful tool for you. When you understand these 3 core things, The wound, the ischemia, blood flow, the infection, and how they're graded, you get a much, much clearer picture of your own unique situation.
It sounds like it moves away from vague terms towards something much more specific about your leg.
Precisely. It allows for a much more accurate description of what's going on, moving beyond those older, broader terms that could sometimes be misleading. What that means is when you talk with your doctors, your nurses, your whole care team, everyone's speaking the same language about the specific challenges your limb is facing. That shared understanding naturally leads to more personalized treatment plans and, hopefully, better outcomes because the care is really zeroed in on your specific needs.
And it sounds like WIFI, while a huge step, is maybe part of an ongoing effort to get even better at understanding these conditions.
Oh, absolutely. Science and medicine never stand still. The medical community is definitely looking at ways to refine this further. There's talk about adding things like a comorbidity index, basically, a way to systematically factor in your other health conditions because those matter too. And maybe finding simpler ways to classify exactly where the blockages are in your arteries. The ultimate aim is always to get that full kind of three-dimensional view. Your limb-specific issues, the WIFI score, your overall health, and the details of your artery problems. All of that helps ensure you get the best, most evidence-based care possible. And I think what's really exciting is this shift in focus. It's moving beyond just, did we save the limb, to looking at patient-centered outcomes. What actually matters most to you, your quality of life, your ability to function, to do the things you want to do, that's becoming central.
So we've really dug deep into this WIFI system today. Just to recap, it's about wound, ischemia, or blood flow, and foot infection, with each part graded from 0, meaning none, up to 3, meaning severe.
And this system helps your doctors grasp the specific threat to your limb, tailor your care plan, and talk about treatment options with you much more clearly and precisely. It's about making sure your unique situation is addressed.
And knowing about WIFI, even just the basics we've discussed, can genuinely change the conversations you have with your healthcare team. It lets you ask really specific questions. What are my WIFI scores right now? If we do this treatment, how might my scores change? Understanding your house damage, your plumbing issues, and your fire risk, using those analogies, it really puts you in the driver's seat, making you an active, informed member of your own care team on the road to healing. So maybe the question to leave you with is, what steps will you take now to use this understanding and engage more deeply with your care team today?